Good afternoon. We actually here together, all the leaders from the McDonough County and the Macomb, to address some of the questions that people actually have posted based on our requests. And we want to make sure that everybody's getting the information that is needed in order to keep everybody informed. We're gonna start with the Mayor Edmond. How many volunteers have been trained in medical in our community?
So as volunteers, Edgar, as you know, we have a reserve medical corps. It's about 50 or so folks. But there's also, I want to remind everyone that, for example, all of our city police are trained at the first responder level. So quite a few more than you might expect. Not just the ambulance service, not just the fire department. We have not only a list of volunteers, but there's also an option for us to access other volunteers in the community through the American Red Cross and the Salvation Army.
Excellent. Is the McDonough Hospital prepared for this?
We are. Thanks, Edgar. We appreciate being here. McDonough District Hospital has been prepared for incidents like this for many years. We've dealt with flu. We've dealt with various other virus outbreaks. Specifically, we've had about 20 leaders within our organization trained through the incident command system very recently, and we've implemented that since March 12th of this year.
All right. Lynette, how is the employees being screened when they go to the nursing homes?
The long-term care facilities have been given directive by the Illinois Department of Public Health of guidelines to screen their employees and their residents as well, and any visitors that are necessary to arrive. So they have a guideline and protocol they're following for that.
All right. Mr. Chairman, what would you say is our normal meeting schedule with each of those partners?
It's been very good. Edgar has been an excellent as far as organizing these meetings, and at the county, we are relying very heavily on Edgar's expertise and the health department's expertise, and I would request anyone that is seeking factual information to go to the health department's website to obtain that information.
Excellent. Mr. Mayor, what do you say, well, have we waited so long to have a meeting?
Well, I understand the perception in the community might be that we've waited so long, but for example, first discussions regarding COVID-19 began between myself and the administration at the university on February 26th. Right after that, the following day, I had an opportunity to meet with the director of the health department and discuss with her the protocols at the time. She provided us with handouts and information from the CDC regarding reducing the spread of the virus immediately. We disseminated those to city staff so that they would be readily available to offer guidance to folks from the community if and when they called in asking for some direction from us. There's been a series of meetings that we have held, most importantly at conference calls with our state partners, including Governor Pritzker. Those started on March 6th. We had another conference call on March the 12th. And then we also participated in conference calls with our state partners as recently as yesterday. I'd also remind folks that this has been ongoing discussion at City Hall since our meeting with the health department on the 27th. And again, I understand that maybe the perception in the community is that we've not been holding meetings, but be assured we have been.
Well, and in addition, this has been such a fluid event that we can create some directives today, and tomorrow we have to change the directive. As we started with 1,000 people separation, now we went to 250, and now we're down to 50.
Right.
And there's more to come, even to 10. So.
But one of the things that is consistent, and you're going to hear it from all of us partners up here, is that the most effective way of controlling the spread of this virus is all the guidelines that we've been consistent in saying from the very beginning. Consistent hand washing, consistent frequent hand washing, social distancing. We hope we're modeling that in this event today, and that we're 3 to 6 feet apart, and encourage the community to abide by our suggestions to stay home. There are essential needs, and we understand that, for the community to be out, get groceries, go to the doctor, get gasoline, but otherwise they should be making a concerted effort to stay home. That doesn't mean necessarily stay inside your house. There's opportunities, it's spring, there'll be opportunities to work out in the yard if you're healthy, but limit your interaction with other humans. That's what we're asking folks to do.
You want to elaborate a little bit more on that, Lynette, about social distancing and why should we isolate ourselves?
So that's an excellent point. And yes, we are strongly suggesting people stay home. And it's not just for the people that are at home. We realize that a large majority of people who get COVID-19 will recover just fine. Their symptoms may be mild, but we're really trying to protect those that are in that immunocompromised population, the over 60 population, and reduce their risk because they are at a very high risk for some severe respiratory illness and possibly death for that. So we're really trying to reduce that risk for them and to slow the spread as well and reduce the stress on the hospitals.
Excellent. Mr. Chairman, a lot of people are basically worry about the effects on their businesses, on their home, their livelihood. I understand that there's some new regulations and new programs coming out. Could you elaborate a little bit more on that?
I would encourage everyone to go to the Small Business Administration website. They will have help. I understand there's bills in Congress and probably in the governor will be coming out with some things as well to help ease the pain that everyone is going to have to suffer some pain in this, and hopefully we can have some help on the national level at easing that pain.
Scott, just on that point, both the Macomb Chamber of Commerce and MADCO have a direct link to the SBA help website on their website. So you don't have to search very far, just go to MADCO or MacombChamber.com and they'll have a direct link for small business owners that are needing some guidance and wanting some help.
Excellent. How is MDH screening their employees? Is there some sort of process in place? And if I feel ill as a customer, as a patient of NDH, how will I go about attending the hospital?
Great. It's a great question, Edgar. And to your first question, we have a comprehensive screening process for all of our employees. We have screening checkpoints at the main hospital building and health services building 1 and 2. All employees, we've eliminated multiple entrances and created main entrance access points only to those buildings. That's in order to not only protect our employees, but to protect patients. Every day, anyone that gains access to our facilities is getting their temperature checked as well as being asked 3 general questions about how they're feeling. Are they experiencing any cough or flu-like symptoms? To your second question, if anyone feels sick or feeling flu-like symptoms, as Mayor Inman alluded to, we really encourage people to not come to the hospital, but call their primary care provider. If an individual is not feeling well, and they don't have a primary care provider, we have established a MDH convenience clinic, and I would encourage each one to call that convenience clinic if they have questions. That's 309-837-6937.
Edgar, just to follow up there, I know some folks are concerned about our police and firefighters and how we're keeping them safe so that they can respond to calls. Much like the hospital, our police and firefighters are being screened at the beginning of every shift to make sure they're coming to work healthy. And to that end, we've had a great opportunity to work with our collective bargaining units, the International Firefighters Association local and the FOP local, and getting our firefighters and police officers, the true first responders in the community, to cut back on some of their options for time off so that we make sure they're here and available to respond. They've been very amenable to stepping up. We don't see any issues with other than as they become exposed and they need to go into quarantine. We have great firefighters, great police officers across the board here in the county, and we have no reason to suspect that they won't be there for us when and if we need them.
Excellent. I'll leave this question open. I'm feeling healthy and I'm in Macomb. I'm having trouble. Why do I need to isolate?
It's really to protect an individual and protect those that they're closest to. One thing that we have learned from the CDC and from the Illinois Department of Public Health and with Lynette's guidance is the virus itself is very contagious. And so even though you're feeling well, we don't want to create an opportunity where someone is exposed. So isolation is one of the key practices that we're all saying is a proven strategy.
And as a parent myself, one of the other questions is, I got my kids in school, off from school, at home, can they go visit friends? And the answer is no, because we want to keep everybody from preventing contact and keep that isolation. Lynette, how is this different from the flu?
So in the beginning, we saw a lot of people compare this to the flu. And it's different in a number of ways. It's a different strain. We're only about 6 weeks into this so far here in Illinois, and the numbers we're already at 288 as of yesterday. But when we look at the seasonal flu, that's an entire year's worth of numbers compared to a very early disease here. So we're only a couple months into it for the entire world. So it's different in that fact. It's different in the fact that seasonal flu, we all have an immunity, some built up immunity to it over the years, and we offer a vaccine for that. But for this, no one has an immunity to it. It's a brand new novel virus strain. And so no one has immunity to it, and we have no vaccine for it at this time, although it's in development.
This following question is basically for Mr. Chairman and myself. Are we declaring a state of emergency? Is that something that we should consider?
We will consider it at the proper time, and we'll look for directives from you and from Lynette and the state government and federal government to declare that emergency.
To follow up as well, there's certain requirements that we have discussed, and one of them is when or if we ever get a case of COVID-19 here, this is when we will activate the emergency. That's one of the requirements that we were talking about. Should I be stocking up for food, hoarding up all the stuff?
You know, first of all, I want to thank all of our grocers here in town, wherever you're getting your groceries. You've been there, you've seen some of the empty shelves. I want to take a moment to thank the management of all those establishments, the employees that are there working diligently hard and many long hours to make sure that not only are the stores stocked, but that they're clean and that you're not walking into an environment where you're put at additional risk necessarily. What I would encourage folks to do is that they should be prepared for about 2 weeks of, that's been our goal from the very beginning, some degree of isolation for 2 weeks. Those stores continue to be open. And as we suggested earlier, under the guidelines of isolation, if you need to go out, you should make an effort to focus on that type of going out, go to the grocery store. What I'm convinced of is that the nation's food supply and the supply chain getting it to us is stable, and there should be no reason for hoarding. I also understand when you go to the grocery store and you see empty shelves, it's concerning. What I've found is that those shelves are routinely, in most cases, stocked very well the next day as additional supplies come in from overnight shipments. I would ask folks to be very mindful of that, and that we should be good. We should be okay.
And to follow up as well, Mr. Mayor, the supply chain management of all these grocery stores, we're going to be meeting with them as well, just to reassure them that if they need something from us, we will be there for them. But they have a really stable setting as of now, and we shouldn't be worried about running out of anything, right, as far as we can keep these trucks coming in and out of town.
One of the real aspects of that is for people not to hoard things, not to take more than they are going to actually need, and leave that for the next person that comes along. Right. So don't create a hysteria, and then your neighbor might not be able to get those things. So take what you need, but no more than what you need. I would add that, Edgar.
Excellent. What are some of the, is my pet compromised with this, Lynette? Is this transmittable to animals that we know so far?
I would check the CDC website for that, and also your local vet. They would be a better expert in that. The guidance for all of this is coming out constantly, and so we continue to learn more about it each day, but they would be the best expert for that.
And what would you say how deadly it is?
That is also
It
an
keeps
evolving
changing.
situation as we see part of the point of isolation and quarantine and just asking people to stay home is to help reduce that. And if we do our jobs right and if people abide by that, we're going to be successful our success is going to be shown by not having, by stopping that spread.
Excellent. And this will be for everybody. What kind of resources do we have here in the county and the city? Is it going to be enough for everybody?
Well, that's what, we got several things going on to make sure that that's the likely outcome. By continued isolation and abiding by the CDC's guidance on social distancing and keeping yourselves away from public contact will make the need for those additional supplies less. So that's what we're trying to focus on here. Do we have what we need right now? We do. As things were to spiral in another direction, those issues are going to come up and we may be taxed. We're trying to avoid that, and now's the time to set that in motion, to limit the number of people that are being exposed, eliminates or limits or reduces the number of pieces of PPE, personal protective equipment that we need, and the kind of strain that we may be putting on the healthcare system.
As a follow-up, Edgar, one of the things that we're doing is we're always tracking our utilization of resources as a hospital, being a 24-hour, 7-day-a-week operation. And so we're continuing to monitor that on a daily and hourly basis, and so it enables us to not only plan ahead, but to see if there's any deficiencies down the road into the future, depending on how long that this process evolves. But we've been very appreciative of the help that you've provided, as well as Lynette, to keep us abreast of not only state and federal resources, but also for us as an ability to communicate if we do end up having any kind of need, that we have those resources very close to us. So we appreciate your assistance and coordination.
I think with this we will close out. One of the things that I want to thank everybody for taking the time and coming out. I think this is something that we did once, and we love the way that we can provide information to our community, and we're going to keep doing in a regular basis, hopefully. If you have any questions, either refer to the City Hall, the ESDA office, the Health Department, and we will try to address it right away, or we can compilate a group of questions like this one and basically answer it. I thank everybody for being here, and I feel assured that we have all the resources that we need as far as people go. We have a really diligent amount of people in this community that will make whatever we confront happen, and we will make it great. So with that,
I just want to add, Edgar, you asked about our county resources. The people are our greatest county resources. Yourself and Lynette have trained very hard for exercises like this, and in cases, situations. We commend all your efforts, and I feel we are in very, very capable hands with both of your leadership. So thank you for that.
thank you. Well, thank you. We'll have another video soon. Thank you once again.